So I think we have a lot to gain in that. The other community that I'm very interested in reaching out to and building a bridge with is the medical community. Another one that each comes up with all the 7 critiques that Chris Krusser came up with in his talk today.
Yes. So why don't you expound on that and talk about how you think that we can do this? How do you think that we can break into the medical field and actually have some impact?
So I think there's 2 ways that we're going to reach out and have an impact in the medical field, and I would say to medical practitioners that it's by leading by example and talking to friends one by one, getting one friend to come to this conference or the Ancestral Health Conference. But I think you have much more power with physicians than I do. There was a study done a number of years ago that was shared when I was in medical school, is how do doctors make a change? How do they adopt a new drug in their practice? And primarily, it's by anecdotal evidence. When somebody in their family has had that problem that was relieved by that drug without a side effect, then they'll receive the drug rep and consider doing that, drug in their practice. And similarly, I've had a lot of patients that have been hesitant. They've gone out of their way to seek a primal or paleo-friendly doc. I want them to go back to their regular family doc and say, hey, look, I'm off all my medications. I've been eating real foods, and the doctor's nodding, and this is great. I've cut out processed foods, great, and I'm eating paleo. And then explain to that doctor what it's about. So I think you all have the power to gradually show your doctors how healthy you can be if you're following a paleo diet.